Hello, Dr. Reddy. How are you today?
Well, Nivedita, you must be fed up of me asking me all these questions.
No, I'm not. So, I have come with a very interesting topic today
Mhm.
because we see these patients in emergency mostly and they're very anxious. So, I
Mhm.
thought I'll just take up this topic to make things clear for everybody.
Sure.
So, this is bleeding in pregnancy.
Mhm.
So, first thing I'd like to ask you that what are the causes of bleeding in pregnancy?
Before I answer that, I'd like to divide pregnancy into what it's already divided,
Yeah.
which is the first trimester, the second trimester, and the third trimester. The first trimester typically extends up to 12 weeks, the second trimester up to 24, 28 weeks, and then towards the end of pregnancy. So, in the first 3 months, and that is when most women typically have their bleeding, which could either be a fresh loss, quite a heavy bleed, or just spotting. Now, the main reason for this would be what we call a threatened miscarriage, in which the pregnancy may or may not continue healthily, and therefore bleeding is a sign that this pregnancy is not healthy or it may not continue. Having said that, because it occurs in about 30% of women, most pregnancies do go forward. The other cause for bleeding in the first 3 months or the first 12 weeks is what we call an implantation bleed, when the pregnancy is actually implanting, and because of that process, there can be a bit of bleeding.
Yeah. And I think the third would be the ectopic pregnancy.
Yes,
Yeah.
yes, yeah.
Yeah. Yeah.
Thank you for that. So, an ectopic pregnancy is a pregnancy outside the uterus, which is dangerous and which needs to be ended because it can have dire consequences, including in resulting in the death of the patient.
Yeah.
So, if somebody tests positive and has bleeding, or for that matter, pain in the tummy, they need to seek help straight away.
Yeah, yeah. So coming to the second trimester, you were telling the causes of bleeding would be what would be the most common causes?
So, again, in the second trimester, women are still vulnerable to miscarriages, although it would be a later miscarriage. That's one. Two, the cervix or the mouth of the uterus, which is supposed to be tightly closed, can start opening up silently without any symptoms. And this may be one of the first symptoms of a slight reddish discharge that can show up as bleeding in pregnancy. And the third one would be the placenta or the afterbirth being a bit lower down.
Yeah.
And of course, sometimes women also have local growths in the cervix called polyps, which are not cancers, which can again cause bleeding.
So again, talking about low-lying placenta, we have so many women coming in with low-lying placenta, being so anxious about how is the pregnancy going to go forward. So I would like to tell them about this in a bit of detail.
So a low-lying placenta is not something serious. Usually, in about 98% of women at term or whenever they're supposed to deliver, it goes up. So, if this is the uterus, the placenta can sometimes be lower down there, but as the uterus grows, it tends to go up. In the 2% of women in whom the placenta continues to be low, we will have to make a plan about how we manage the pregnancy and how they're delivered.
Yeah, and does it also depend on the patient, that this is their second pregnancy, third pregnancy, whether they had previous cesareans? Because we have heard stories with massive amount of blood loss during the deliveries.
Yeah. So it's a good thing that you brought that up. So women with previous cesarean sections who have a low-lying placenta or a placenta previa at the time of delivery are at a higher risk. So they need to be delivered in a hospital fully equipped to deal with huge blood loss.
Yeah, and but with the multidisciplinary team of doctors, I think they should think about that.
Absolutely.
Yeah. So other thing that I wanted to know from you is what kind of any medications can we give to these patients when they're bleeding?
So in the first trimester and even in the second trimester, we can give them a progesterone supplement that is supposed to help with this condition.
Yeah. Anything else that you want to add to it?
So in the third trimester, what we call the final leg of the pregnancy, you can have bleeding. And we've already discussed placenta previa, which is a low-lying placenta that can give rise to bleeding. There is also a condition called abruption. Abruption is when the placenta starts tearing away from the uterus, and it happens. We do not know why it happens, and this can cause bleeding. And this can cause problems for the baby and for the mother. Whereas with placenta previa, by and large, it causes a problem to the mother because she tends to bleed torrentially and doesn't affect the baby until the very end. Yeah. So take-home messages, any kind of bleeding in pregnancy is not normal. People ask me, oh, is this normal? It's not normal, but different reasons at different stages of the pregnancy. And obviously, if there is any bleeding, you need to go to the hospital. A telephone conversation or a telephone consult will not help, because you have to be examined and then appropriate treatment instituted.
Especially when you are near your due date.
Absolutely.
Yeah.
Absolutely.
Yeah.
Yeah.
Yeah. Thank you.
You're welcome.